It's so vulnerable.
Every single patient I talk to
Yeah.
brings up the same things. So if you are out there, you're not alone. We all go through this. Reach out to whoever you know. 1 in 10 in America. In
Exactly.
Australia, they have new tests that are in circulation. So now it's 1 in 7.
Endometriosis isn't just a bad period. It's a whole body disease that impacts at least 1 in 10 females at birth. And yet, most go years, sometimes over a decade, without a diagnosis. It's misunderstood, it's under-researched, and it's often dismissed as, just a reproductive issue. This podcast is the space for the real talk. The stuff we whisper about and cry about and scream about, and the small wins that we celebrate along the way. We are here to connect, to get honest, and to share what we're learning as we navigate life with endo together.
Hear us now, we won't stay quiet. Through the storm, we'll rise to fight it. Our bodies ache, our voices roar. We're stronger than we were before.
Hi, Sharon.
Hi, Ruti.
I am so excited to have you here. The first time we met, I would say 2-something years ago at this point. I
Maybe.
remember I got just so excited about your personality, and I didn't even realize how much closer we're going to get and how we're going to work together. And I'm so excited that everybody gets to know you now. So why don't you introduce yourself?
Okay. Thank you. And yes, I also often think about how almost coincidental it was. And really, as we were departing in that
Yeah.
meeting, you were like, wait, what do you do? And that's actually how we started collaborating, which was, yeah.
Yeah.
So it's really amazing because if you didn't stop that like 1 second, we wouldn't have been here.
Yeah.
And
Crazy.
such an amazing journey together, growing our ideas, and we keep learning from each other. And so thank you for that moment 2 years ago. I work as a clinician in an outpatient setting, a lot around anxieties and kind of like self-esteem and many, many transitions in life in which we kind of like fall on our behind and go like, what now? What am I going to do now? How did I get here? And during this journey, I also worked with you. One of the things we worked on was the guide, right?
Yeah. That was an awesome experience for me, I have to say. Writing it with you, I remember the first time when we started talking, and then I was like, oh, she really gets it. Like she gets
Mm.
what I'm talking about. And then I was like, okay, let's see what she can write. To be honest, how busy you were and how my experience with other people went, I was like, probably not going to see anything back. And then you did, like the next day, I was like, okay, so I wrote like 10 pages and now let's talk about them. And I was like, wow, she's a keeper.
And here we are today. Yeah.
Yeah. So really, what got you? Like what for me, I mean, I'm just taking it as, of course she clicked and she just wanted to help us. But like, for real, this was so much work, a lot of hours, and it really seems like you very well understanding of
Mm.
the experience of chronic pain and endometriosis and how it affects our lives. What got you into this?
Yeah. That's a great question. My experience is slightly like adjacent. Many, many years ago, I'm not going to date myself right now, uh, but many years ago, before there was a lot of research around IBS, irritable bowel syndrome, I was diagnosed. And after the invasive procedure, that was extremely painful. The doctor, male doctor, basically said, well, the good news is that you don't have anything I can prescribe anything for. The bad news is that you don't have anything I can prescribe anything for. So it's like, good luck. And really, there was no, here's what I recommend. There was no, here's what we see, nothing. It was really just It is what it is. Keep living with ups and downs and uncontrollable, and you don't know when it's going to come, and you don't exactly know what's causing it. This was before all the FODMAP research about like food intake and self-care and meditation before that world. Um, yeah. And so, as you can imagine and can relate, I am sure there are a lot of symptoms that are really hard in social settings, or it's hard to be social when you have them. You don't feel good in your body. You're not yourself. You can't predict it. There's a lot of things that I know you can relate. And for me, this was my entry point to relating and putting myself in these seats, right? Like in this pain. And this is where I drew a lot of these things that we talked about, that we connected on, that we then kind of put together into those 10 pages.
Yeah. I have to say it does sound very familiar. Like this experience with doctors, it looked like Schrodinger's cat. Does it exist? Is it real? Like maybe we don't care. It's
Right.
just yeah, it's really
Hmm.
terrible.
Yeah.
So can you really share a little bit about your perspective? Because IBS is also really similar to endometriosis in terms that it's chronic. There's not specific cure that could really make it go away. So like what's your perspective, psychological aspects and how it affects like this chronic pain and stress and this whole diagnosis process and journey that we all go through?
Wow. So many feelings and they coexist, and it's unbelievable how many different feelings we can have at the same time. Starting from the moment of, like he said, getting a diagnosis, right? He was like, here's a diagnosis and I have nothing for you. And it's good news and bad news, right? And how do you deal with that? Like, what do you do with that? Am I supposed to be happy that I don't have something like worse?
Yeah.
Um,
This is something that
Probably.
I heard a lot, actually. This is awful. Like, well, it's not cancer. Well, at least it's not cancer. Like,
Exactly.
yes, obviously people have it worse, but like until a year ago, I was better. Like,
Yes.
I, I, I'm allowed to be crazy and like my entire world is collapsing,
And
even though it's
mourning.
not cancer. And
Right.
we're not taking away from that, and we're not taking away from the whatever people is facing that is not endometriosis, but we also need to put room for this.
Right. Absolutely. And one of the things I heard you kind of allude to is the grief, right?
Yeah.
So with the diagnosis comes a moment of, who am I with this? And who am I with this is different than who I was just a second ago without this diagnosis, because until that very last moment when the words are stated, there's still hope. There's still, oh, they'll just do one thing and I'm done, you know? And that world is just goes like poof, gone. And
Yeah.
now comes this like huge void of, now what? Now who am I with this diagnosis? So obviously, like we said, there's, grief, depression, anxiety, right? Like our thought starts running, right? We're like,
Oh
oh
yeah.
my God. And we start going, and with those thoughts, spiraling thoughts, come anxiety. There's also, of course, like frustration. Did I do
Oh yeah.
something wrong? There's self-blame. There's like, how come I got it? Where is this coming from? There's anger. There's, helplessness. There is, and on and on and on, right? And
Yeah.
it all hits us, boom,
Yeah.
right at that moment.
Yeah. And I feel like with endometriosis, we don't talk about it enough because there is also, because the diagnosis is so hard, and most of us, like the average time is still over 10 years to get a diagnosis from the moment you
Mhm.
realize your symptoms are bad enough to seek something. So a lot of times what I see for us in the groups, in like someone gets a diagnosis and everybody's like, congratulations, now you know what it is. And she's like, I'm so relieved. I
Yeah,
know what it is. I have a name for my pain. So it's kind of
right.
like a crazy roller coaster where a month or two after, like, you're getting after the healing part, you're getting to like the real life part, and then it hits you.
Yeah.
And you're really not even ready for it because you're like healed, you're post-op, you're good. It's really not talked about enough.
Another aspect, like you're saying, is the impact on our daily life started well before that diagnosis. Until
That's
then, we
very
didn't
true.
have a name for it. We didn't have a quote unquote excuse for it. So we were, we constantly worry about how are we perceived. People think,
Mm,
oh, she's lazy, or she's like, slacking off. Oh, another day she stayed home. Like, what is this pain, right? Because you don't
mm,
have a name for it. So disruption to like work or social life, bailing out on like friends, like, no, I really can't. And not a lot of friends like stay. And also like, what do you tell them all this time? I'm
right.
not feeling well. Like, so a lot has happened already, a lot
That's
of
very true.
scars already before even our first surgery.
That is very true. You know what? I never thought about it that way. But yeah, I lost most of my friends before my surgery. I
Hmm.
lost a lot of mobility before the surgery. That what pushed me to surgery in the end because I was like, okay, like this is yeah, this is clearly a problem. But it needed to be this clear, with all the years of gaslighting from medical people. It's just like, I'm probably just overdoing it. I don't know, I'm too sensitive.
Right.
It had to get really bad for me personally to
Yeah.
seek help. And I know I'm not the only one. I know a lot of people like and sometimes they do. Sometimes they do seek help and they're being told, no, everything is fine. You're normal
Yeah.
until it's too late.
Yeah. Until it's so big that cannot be ignored anymore.
Yeah.
Yeah. With this point especially comes the moment of should I have spoken more? Should I have like all the I should have, could have.
Yeah.
And so then you're beating yourself up and there is
Yeah.
so much around this moment.
Yeah. There's a lot of like, how did I not see it before? I think because we just kind of like, I'm gonna go, go, go. Everything is fine. If I'll ignore it, it's gonna be okay. It will disappear. And then, like, as soon as it hits you, I'm looking back and I'm like, how did I do that 24/7 before? I have a bad flare. It reminds me of times where it was like this really almost all day. And how did I think this is normal
Mhm.
for so long? It's it's
Yeah.
crazy.
Yeah. We tend to minimize our own needs and our own pain. And especially as women, we tend to try and do more, be more, right? Because to kind of like to just be seen as peers, we have to do so much more all the time. And so
Yeah,
it's not no difference in these circumstances, right? And so we push our needs and we push our health in order to
yeah,
meet other things.
yeah. And I feel like with endometriosis also, we also have to there are so many big decisions that we have to make to even get there. Like, how do you even decide to go for surgery? Such a huge, scary decision. Um,
Absolutely.
and most of us do it without knowing anything that
Mm,
is actually relevant and critical for us to know to
yes.
schedule it. What's your take really on this? Like how that plays a role in getting a diagnosis and delaying it?
I think you bring up two really strong points. One of them is with that moment of diagnosis, or like with that moment of we highly suspect this, which is why we recommend a surgery at this time, comes a very big moment of overwhelm in the sense of what is this new world and new diagnosis that I need to research all about it, and where do I even start and what does it mean? And so there is a big overwhelm around that, kind of stepping into this new world of who am I with this, right? Another aspect is, of course, the actual surgery or this whole moment around surgery. First of all, a lot of us are otherwise healthy. We've never
Right.
even seen an OR before, right? And so we haven't had anything that is so invasive. Um, and that in itself can be very scary, right? So it's already a moment that you're super vulnerable. You have no control over it, or you know you will have no control, like in the OR. Um, and you're also feeling like you have no control in this moment as far as your choices, right?
Right.
Do I really need surgery? Should I believe them? Should I just go with this guy or this, doctor, because they are the ones in front of me recommending it? Like, are they the
Right.
best person for this?
Right.
Most of the time, we don't even question, are they the best person for this role right now for me, right? We have this big, like, they are the providers, I'm just receiving. I think this is a great moment to take back your power and kind of take a moment to say what is within my control and what is out of my control. What is with my control is to start researching. The more knowledgeable I am around the diagnosis, around surgery, what happens in the surgery, other people that went through this, right? And what will it be like? What's a recovery like? This is a big moment. So really taking the moment to realize, okay, all of these things happened to me until this moment. This is a moment that I can pause. I have more time than I think I have, right? They're not saying we're rolling you in right now, right?
Right. It's
And so,
elective, yes.
yeah,
Insurance considers this elective.
correct. And so really take this moment to realize and regain and take back the control over the things that you have control
You can
over.
choose your surgeon. It's really important. I think a lot of
Absolutely.
people don't think about it. Um,
A lot
a
of
lot of
people don't know
people,
that.
they can, exactly. Yes, you can. Even if you have one OBGYN your entire life, they are probably not the right person to take you to the OR because they're not there all day. They're in office. So you want someone who is in the OR every day, all day, seeing hundreds of cases every week. That's the person you want. Your
Right.
beloved OBGYN is going to wait for you in office to help take care of you afterwards. It's just not the right person for it. And so many people don't know that. And so many people, even worse, I see sometimes patients like chasing the doctor who refuses to operate on them because maybe responsibility, maybe they don't understand how severe it is, whatever reason it is. But if this person does not want to operate on you, you do not want them to operate on you. Like, even if you force them in the OR with you, what do you think is going to happen? They don't want to be there. They don't want to do it. They are probably terrified that they can't do the job well.
Exactly. They probably know very well that they don't know it well enough. They
Yeah.
knew how to get you to here, but that's it.
Yeah. And it's really unfortunate that a lot of them either don't know that they can or should refer further, or sometimes, and I know that from internal information, in some hospitals, if they don't have a specialist in the hospital, their doctors are not allowed to refer outside of that hospital. So that sometimes plays a role where doctors' hands are tied and they really want to help, but they can't. So if
Yes.
you are stuck in a loop like this, go elsewhere. Check her map. Go elsewhere.
The specialist map that you can find on the yellowhub.org is the only resource out there that is solely based on patient's recommendation. Every surgeon that you see there was recommended by a patient who had a good experience with them. I also validate online that they went through the MIGS fellowship, which means they trained to do the minimally invasive gyn surgery. Obviously, that is a pretty wide net to cast, but unfortunately, very few of the specialists actually went through the excision surgery fellowship specialty. And most of them go through MIGS and then work with an excision specialist for a while to get trained, and that's how they're getting trained. But all of them were tried and tested by patients like you and recommended by patients like you. You can search the map based on your location, wherever you are, and I truly hope you find someone really close to you.
Pain is a a shadow that won't let go. It grips my body and steals my glow. Silence screams behind a smile. Walking this road feels like a trial. The world can't see the war inside. The scars I carry, the tears I've cried. Doctors shrug, they turn away, leaving me to fight another day. Hear us now, we won't stay quiet. Through the storm, we'll rise to fight it. Our bodies ache, our voices roar. We're stronger than we were before. Each day's a battle, a brand new fight. Chasing answers in the darkest night. The weight of doubt, it cuts so deep, but I hold on, I will not weep. We are not fragile, we are not small. We stand together, we stand tall. Listen to the stories we need to share. A little kindness could repair. Hear us now, we won't stay quiet. Through the storm, we'll rise to fight it. Our bodies ache, our voices roar. We're stronger than we were before. Hear us now, we won't stay quiet. Through the storm, we'll rise to fight it. Our bodies ache, our voices roar. We're stronger than we were before. Each day's a battle, a brand new fight. Chasing answers in the darkest night. The weight of doubt, it cuts so deep, but I hold on, I will not weep. Hear us now, we won't stay quiet. Through the storm, we'll rise to fight it. Our bodies ache, our voices roar. We're stronger than we were before. Pain is a shadow that won't let go. It grips my body and steals my glow. Silence screams behind a smile. Walking this road feels like a trial.